When a patient has 2 or more unprovoked seizures, they're diagnosed with epilepsy. Most patients aren't aware of what's going on during a seizure. So for their parents, particularly, it's extremely scary to see their child have a seizure. Or, a significant other that witnesses it, it's very scary for them. For most patients, you just want to make sure there's nothing around them they can hurt themselves on. You maybe want to try to, if you can, roll them on their side, gently on their side. You don't want to try to move them. You certainly don't want to stick anything in their mouth. Most seizures will stop within a minute or 2. If it doesn't, you become concerned and probably want to call 911. Most patients will be back at baseline within 20 or 30 minutes after a seizure. If they're not and they're still confused, you probably want to call 911. And certainly if they've hurt themselves, you want to call 911. For the most part, particularly in the elderly population, it could be caused by strokes, tumors, infections, people that have had meningitis, encephalitis. For a good portion, particularly that started in childhood, adolescence, we don't know. There's probably a genetic component, but sometimes we don't know why those patients have epilepsy. For a lot of children, they do outgrow it. So a lot of times children have a kind of a childhood epilepsy that they outgrow by their teens or their 20s, but sometimes they don't. They live with it lifelong. After a patient's had 2 or more seizures is when we usually start treating. We'll usually start them on medicine. There's about 24 different medications out there right now, so there's a lot of choices, and we kind of tailor it to the patient. Most patients will respond to their first medication. 60–70% will respond well, and it will control their seizures. A good 30–40% of patients don't, and sometimes you need to try another medication or even a third medication. The majority of patients will do well with their first medication, and that they will become seizure-free. We have a 2-bed epilepsy monitoring unit up on our neurology floor. We usually bring patients in that are having multiple seizures despite adequate treatment with medication. So a lot of these patients we want to see, are they truly seizures? Because sometimes they're not. So usually we'll taper their medications before they come in so that they'll have a seizure. So we want them to have a couple seizures while they're there in the epilepsy monitoring unit so we can kind of figure out what's going on to help them more. So I try to explain to patients that the majority of patients do well, and if you take the medication every day and don't miss doses, that you're likely to not have further seizures. If there's a concern that someone in the family has witnessed a seizure or an episode of just staring or confusion, or there's some concern that they may have had one, calling our office or even their primary care doctor so that we can start working them up and getting testing that's necessary, such as an EEG and MRI.